Okay, hello, and welcome to our health update with Nanaefua. I'm hoping this connection works. I hope everyone's doing well out there and enjoying some parts of this social distancing, taking the good with the bad. It's definitely a hard time, but some of us are introverts and it's easier in other ways, and some of us really miss that connection. And I know I miss our connection to community. So in a second, we're going to have Nanaefua, who is ER doctor. I'm just waiting for her to request access. I see that she's here. And she's going to answer any questions you might have. So please feel free to make a comment. We'll be looking at those. Hi, I see you're there, Nanaefua. Will you request to join the video, and then I will log you in. 1 second while she comes on. But again, if you have any questions or things you want us to, or want her to answer, I won't be answering any medical questions, then please type them in your comments. Hello, everyone. Uh-oh, I turned it. Wrong view. Hi, Nana. If you want to request to join, and maybe you're having a little trouble with connection, but as soon as you request to join, I will welcome you. Hi, Christina. Let me text her and see. I see that she's there, so let's see. Oh, there you are. Okay, here she comes. Connecting.
Hi, good
Hello.
morning.
Hi, good morning.
Sorry about that. I think I logged into my personal.
No worries.
Oh.
Yeah, that's different. Thank you to everyone who's joining us. As you know, we are here with Nanaefua, and she is going to answer some questions that you have and also give us some updates. Welcome. How are you? First of all, how are you doing? You're on the front lines in the ER room.
Yes. When I'm there, I'm like in the zone. So I try not to think too hard and focus on just the patient and me and everyone, one patient at a time kind of thing. This morning I went for a run and came back to gonna hear some background because I had some police helicopter around the neighborhood. And yeah, so life continues.
Yeah, just staying real is what it is. Yeah.
Okay, so
good. Well, I was going to ask what you're doing to stay well, but going for a run is clearly a brilliant thing to do.
Absolutely. As much as you can move, dance, run, stretch, get those endorphins going just to clear the mind. It's so healthy. It's so important right now.
Yeah, and that'll just, one question I did want to ask is, we're staying at home as much as possible, except for necessary outings. But we're also taking neighborhood walks. I know we're avoiding the beaches and the parks and the trails now. What are some tips when it's still safe to walk around your neighborhood, I assume?
Yes, it is. It's still the same thing. Keep a certain distance, 6 feet distance. If you notice, some of the restaurants are doing takeout and they have circles and lines to give your, enforce self-distancing. When you're walking around, make sure you just carry important protective items. So you're thinking always about what's going to happen if, like, I fall or all of a sudden I go into a sneezing spell. So it's not so much that you can't do it, but just protect yourself. Bring tissue, bring sanitizers when you're walking around, and always have someone know where you're going buddy-wise, because there's less people around. So it's always nice to kind of create that little buddy system. But
okay,
yeah.
That's smart. Your buddy that you stay 6 feet away from.
Exactly.
I was like, can we do a double date where I drive and we park across the street from another couple and like we talk to each other?
Yeah.
That's a whole nother conversation for another time. But I want to start off, really, there's a lot of misinformation still inundating my inboxes, and maybe, we know the basics, like you said, stay 6 feet away, wash your hands, don't touch your face. But are there any new updates on additional things that we should be doing that are based in, the facts of what you're seeing and what your research is finding?
I think one thing off the bat, and also to kind of quell the understanding of why the young people who do get it and don't do well, because that's the reality. We are seeing numbers. There is an association to those young people and vaping. So we have already talked about recently, even before this, some of the early consequences of lung disease due to vaping.
Wow.
And those individuals are now in that category of immune compromise. So that's something, we think, we vape and all that. This is great, but I think that's something that fell under the radar because we just wasn't thinking about it. It's a new thing and we're just now getting a sense of it. But in this setting of this disease, the younger adults who are ending up in the ICUs and on ventilators have some kind of smoking, respiratory, vaping history. So I think that's something to be attention. And
that's
so in general,
go ahead, sorry.
I was just saying, so in general, I mean, if you're vaping, just don't right now. If you're, whatever you can do to maximize your lung capacity and avoid anything that's compromising you. And then that includes, we understand, for those who do have a difficult time quitting, or this is the time to contact your doctor or to get some of those alternative options going for you to help you stop or refrain from nicotine use right now.
No, that's really important information and something I actually hadn't heard before just this moment.
Yeah.
So, because we are hearing that young people, and that was something that we felt immune to. Well, I'm an Gen X older person, but that
Gen X is not older people.
Well, thank you. Okay. But what are some of are there any other, we know it's droplets. I know they were doing a test where they were aerosolizing it. Is it still the same droplets, touch your face is the basic transmission? Or, because now I'm feeling like we walk through and the air blows coronavirus to us for a lot. And I'm hearing my friends like, no, don't even like walk outside your deck. What is that? Is it still the same? Are there any new pieces of information? Is it still that basic droplets enter your system? And how does that work?
Yeah, and Bridget, this is why I love you providing this platform, because it's true. The facts are the facts. And, when you don't know anything else and you see a lot of numbers, you start creating a lot of other stories to explain your anxiety around what's happening. So the fact is still 6 feet apart. It's still a droplet issue. They have done case studies of, is this aerosolized something that we need to worry about? There's nothing definitive about what they're doing and what they're looking at in terms of transmission right now that's confirmed. The time of how long it stays around in your space, whether it's what type of material, whether it's glass, whether it's copper, whether it's paper, same thing. The numbers are about the same depending on the variability of material. But the bottom line is, if you sanitize your space before you use it, you're protecting yourself. One thing to note about sanitation is when we're using the alcohol preps and the Purells and whatnot, you have to get it to dry. It's not the wet and then go. You got to give yourself time to dry. Other things, techniques about washing hands. We're like, oh yeah, just wash your hands. But that washing hand technique should be 20 seconds. And 20 seconds is like, you're washing this way, then you're washing this way. A lot of people forget to wash their thumbs. So make sure you're washing your thumbs. A lot of people forget to wash underneath their nails. I have a son, so that's something I've got used to, like going right with his nails. Yeah. But it goes back to that mindfulness in everything you're doing. Slow down when you're washing your hands. Slow down when you're putting the Purell on. And those are the things that are going to be most effective.
That's great. Slow down, I think, is something we're all forced to do at the moment. And it's really kind of a keynote. Thank you.
Yeah.
I'm going to jump to, we have a question from Mutual Carbonation, which says, how can we as non-medical professionals best support the health heroes? If we can't physically show up for you, what can we do besides stay at home?
I love that.
Thank you for that question. Yeah.
I love that question. You know, where I'm involved due to various task force and especially from COVIDMD, various volunteer organizations, I think the most important thing is when you decide to get involved within a group, because organization and organized engagement is so important right now. So what COVIDMD is doing, myCovidMD, is whether you are a healthcare provider or not, we need logisticians because we are going to be doing something called pop-up drive-through testing areas so we can get more testing opportunities for people who don't have access to testing. And those pop-ups, you know, they're just like any pop-up shop or music event. You know, the orchestration of all that is required. And the difference with the pop-ups is everyone is staying in the car. So we're literally reconfiguring an in and out version of an opportunity to test. So those are like the kind of things that you can get involved in myCovidMD and then on that myCovidMD, because we're part of different task force, you can indicate what you're good at, what's your background, and how you want to help. And then we can triage you to the various other volunteer organizations. Kids are coming up with beautiful skits on TikTok about, you know, what kids can do to help their parents and their grandparents. And that's an organization that we're affiliated with too. So, but the key thing is you want to do it through an organization. You don't want to go at it like, what do they call rogue? Definitely don't show up at a hospital with a whole bunch of food, or no hospital is going to take your food, even as good as it smells.
I mean, my grandmother's gumbo, they might make an exception because it's amazing. I'm just saying, but but in all seriousness, that's really helpful, and thank you for that question. And to that, we're going to talk a little bit about myCovidMD MD in a second.
Yeah.
But again, maybe we're hearing another myth, or not myth, another thing we've heard that was a myth, and now they're saying like these mass doses of vitamin C trials. I saw that it was like intravenous, but you know, am I supposed to start like eating on my vitamin C? I normally do them anyway. But what can we know about that? And I think the big idea is, what can we do to boost our immunity? What kind of food should we be eating? What should we do so that we just stay as healthy as we can in this time?
Yes. So the interesting thing about vitamin C, before I went to medical school, I have a master's in nutrition. So one thing that people need to understand about vitamin C is your body can't take more than an X number amount. So you can overdose on vitamin C, and what you end up doing is peeing a lot. That's all. It just comes out. So, but it's actually a really good strategy, because what we were saying now is that the virus comes out of your urine. So, you know, anecdotally, do you want to pee a lot? Yes, we want you to use the bathroom and pee a lot, but we also want you to stay hydrated. So the water, as well as the vitamin C, some people are using, you know, what's that? Energy C, the little split. Emergency, yes. That's totally fine, and your body knows how to self-correct it and get rid of what is unnecessary. But the hydration part is the most important. I've yet to. There are some infusion centers that are promoting that, and again, it's just a lot of, for me, it's a lot of hype. You know, we just don't know enough about the virus right now to hang our hats on any one cure solution. Okay. So do that. In terms of other ways to stay healthy, your immune system, it's all about hormone balance. So the things that control your hormones are your activity level. And for women, if you're in perimenopausal, if you're taking your vitamins, you want to keep taking those medications that you're on at this time. In terms of zinc is a powerful vitamin, so you definitely want to be taking zinc. Eating, I would say kale. People like there's got to be more to life than kale, but kale is really great. Kale and carrots, right? Beta carotene is really good as well right now. But you know, everyone's immune system is different, so if this is where you have to slow down and know your body and know how you feel when you are in deficit of things and when you are not. And I think those who had that ability to connect to their body before this are going to know when they're feeling a certain way. And this is just a great opportunity for us who had not, maybe to that, start paying attention to our body and how we're feeling.
Got it. Thank you for that. And according to, I can't pronounce anyone's Instagram handles, but it says Hit Esquire, maybe it is. Kale is amazing. So we're just going to throw that out there, and thank you for sharing.
Yes.
And then here's another, like, it's allergy season, flu season, cold season on top of coronavirus.
Yeah.
So I sneeze and have postnasal drip 24/7, so it's nothing has changed.
Mm-hmm.
But if we're getting symptoms that are new, or or you're having symptoms that are manageable, but you're like, this is not my normal symptoms.
Mm-hmm.
What can you do? I know we're supposed to stay at home unless there's something emerging. You call 911 if it's urgent. Mm-hmm. But is there a certain protocol, or is it similar to taking care of a cold, to stay home and kind of self-quarantine for this?
I think there's some gray there. Okay. And that's a great question. We have to remind ourselves that the coronavirus is a community-acquired infection. We have hospital-acquired infections, which are really bad and need aggressive treatment. And then community-acquired infections are an opportunity for us to learn what is it in our environment that is causing our bodies to react a certain way. And if you come to the hospital and we find out you have a common cold or some even pneumonias, will be discharged home with antibiotics because it's a community-acquired pneumonia. Okay. And so in that state, the most important thing, and actually the most helpful thing we can do is when you're noticing your symptoms are changing, mm-hmm. creating a symptom diary book is so critical because mm-hmm. this is going to teach us what we were missing. Was it just fever, shortness of breath, or cough? Or was there more? In the last week and a half, some of the data has shown of the people who were admitted, what other symptoms were they complaining about? Or when they came and were discharged and they came back and admitted, we were seeing sore throat. I was like, oh, wow, we've heard a lot of people who just started with sore throat and we didn't hear about it. And then next thing you know, the other symptoms showed up. So that is going to be so valuable for the medical community for us to start retrospectively looking at, especially those who have allergies, especially if you have asthma and you're like, I'm still okay with my albuterol. I will say something about those who have asthma and are on inhaled steroids or oral steroids. Steroids are an immune suppressant. So if you are saying that you are taking your inhaled steroid more often than usual, I would go to see a doctor. I would go to the emergency room and I would ask them to do a peak flow on you. And that's PEAK. I can drop it in what that is. You can actually do it at home when you have the device. It's a very simple thing that you're just blowing through. If you think of a party favor. But the important thing about that is allows you to just keep getting an understanding of how well your lung capacity is during the times that you're feeling ill. In the hospital right now, because peak flow meters can cause aerosolizing of the virus, they're not going to be inclined to do it. So if you end up going to emergency room with symptoms and they want to discharge you, you ask them, can you discharge me with the peak flow meter? And that's something you can do on your own at home.
That's really helpful. Thank you. And welcome everyone who's just showing up. We're here with Dr. Nanaefua, mm-hmm. and she's giving us some updates. She's on the front lines in the ER, and we're honored to have you as our esteemed guest, but we're also super happy that you're a member of Blackbird.
Yes.
And this is really valuable. I know a lot of us are just watching the news and we're hearing misinformation and then we're hearing great information. And now it's really getting confusing. And somebody asked a question about that earlier.
I wanted to pick up a comment that one of my co-founder Brianna is online.
Hi, Brianna.
She reminded me. Yes. So also remember about something called silent hypoxia. Hypoxia means your total oxygen level is dropping without you knowing. There's some really cool apps right now that will check your oxygen, what we call a pulse oximetry. And I think she can, she wrote it down in the notes, but you can, there's some, I mean, technology is advanced, so you can do a lot of these vital values, I would say, through home, through a lot of the apps that we have on our smartphones. So oxygen capacity, if it's dropping down 95% or lower, you should be 95 or above. Certainly, if you're dropping below 92, it's definitely some reason to at least get it checked or warn your doctor about it. But that is something that you can monitor at home as well.
Great, thank you. And Dreamlight just asked, would you recommend oil of oregano as a preventative method? Thank you for the question.
I cannot endorse or respond to any naturopathic remedies. I don't want to do it any disjustice about that because that's just not my lane.
Perfect, appreciate it. But thank you for the question, and we're here to answer what we can, and again, what we can't, we can't. I wanted to ask about ages, just the last quick, like kind of the scary stuff. We were originally, like you said, young people are getting it, but there was some reports earlier that, or I saw a news story where children under 9 seem to not be getting it. Is that changing as we're getting more testing? Are they being silent carriers? Or are they just kind of not? Do you have any information on what's happening there?
Yeah, that actually question hit close to home because of a case that I had in the emergency room. The actual number of cases of young people under the age of 9 is not really climbing, but they are silent carriers. And I think this is where we talk about the issue of public health. You know, we had a case where, a single mom came in with her 2 kids, and she obviously was in respiratory distress and needs to come in the hospital. But the question wasn't what to do about the mom. It was what to do about the kid. She had 2 kids under the age of 6 years old, and we could not find anybody in the family that would take care of the kids because they were afraid of contracting the infection. And we got down to one of her family members who was literally crying on the phone with me, and she said, I would take those kids in a heartbeat, but my mom is 70 years old with sarcoid, so I just can't do it. And right now, the health system is not prepared to deal with the social aspects and the fallouts of this. And when there's a question of what to do with the kids, if the health system's only backup is temporary foster care, that's a problem.
Wow.
Okay. And so this is what I mean by, it's a community acquired illness. So the community has to step up and figure out how to respond to it. And if there's something like, if you're a young adult and the likelihood of you getting this infection is very low, you're somebody that can help. You're somebody who can take in some kids for a while, especially if you're a teacher and reliable. I'm not saying, no one wants to leave their kids with anybody. But in this case, when this woman, she has to go to the hospital and her mom is already in the hospital, those are the kind of things that we want to mobilize to think about. Because, again, I'll just give you the facts. The numbers are in the world. As of yesterday, WHO reports 462,000 confirmed cases, 20,000 confirmed deaths. That's not a lot, right? In the U.S., 99,000 confirmed cases. We're now past China, by the way, just so you guys know. 3,500 deaths in the U.S. In Los Angeles, 1,200 cases confirmed and 21 deaths. So even though there's a sense in the air that this is scary and it's like taking over and all we see is COVID-19, the reality is the number of people who are surviving the illness is much higher. And so what is going to be a problem is what are the consequences of this hysteria and what is that going to do to the families and individuals?
That's really an important factor. And what are some of the resources that we can use to, find out information that keeps us calm? I know and we can are there sites or channels or things that you're saying that people are doing that are really effective?
Yeah, so there's the Tessa Cleveland Foundation is a foundation of social workers. They have been around for over 20 years. It started with a social worker from Long Beach, Cal State Long Beach, and now they've done work in that space. They constantly need help, support in different ways. So if you're a social worker or have any teaching background, tapping into those communities are important. The mayor's office has a volunteer.org platform as well that you can register for. Again, going to locate the sites, whether CDC now, if you're in Los Angeles, you're focused on just making sure you get the right information from the mayor's office. They do situation reports every day. They come out on the LA Times, but if you go straight through the mayor's office, you can get that as well. As much as you can, keep yourself informed so you can spread the facts and not the fiction. As much as you can quell the hype around it and help people focus on what actually is happening, how they can help with their own skills, the better we all going to be.
Yeah, that sounds great. And Brianna from your office asked about if hotels can help staff some of the caregivers for children. Like, is that something? Are hotels going to be scared to do that? Is there a safe way that they can do this?
Okay, so just like as we know, if you're asymptomatic and you're a carrier, doesn't mean that you're going to pass it on. You still only pass it on through droplets. So hotels are still open for the most part. So if we think of it from that mindset, then you think about it from where can you help? We were discussing the use of hotels because for example, Ronald McDonald House, if someone is coming for chemotherapy, they'll have a house available, right? We were thinking there should be a system in place where single moms or any families where more than one family member has been hospitalized, where are the kids? And can we create these more? It's the same thing as the hospital. There are units where the hotels have rooms, and then we can easily have medical providers, where there's nurses or CNAs checking in on each individual room like they would be in the hospital. The hospital is, like I said, surge capacity is real. So we only have so many beds and there are only so many units, but the hospital is a low budget hotel for the most part.
Right. Yeah.
So if we can reconfigure our minds in the space that we're in to think about creative ways to do that, then by all means we should do it, because it's, again, self-distancing, but we don't have to isolate.
That's really great. And if any of you out there have hotel connections and you're wondering what to do with your empty rooms, please contact Shared Harvest or contact us and we'll put you in touch. It's really important. We got a really great question from Scout Allen. Of course, I never can pronounce this. I think that's very clear. Can you recommend an online service where you can see a doctor for non-COVID related systems if you don't want to leave your house or overwhelm the system?
Right now, if you have insurance, most of the insurance companies are ramping up on their telemedicine platforms and their networks. So depending on your insurance, you probably already have a telemedicine provider. Mm-hmm. If you don't have insurance, more than 90% of the telemedicine providers, including myCovidMD, which is our partner of CovidMD, takes direct pay. And they usually anywhere range from $20 to $40, and those are for non as well as COVID. You have to keep in mind, even if we're coming to the emergency department, it feels like it's not, but doctors are looking at the whole patient. So if you can't say you have non-COVID related issues, because if you're having issues, the goal is to find out what is the issue, not necessarily are you COVID or non-COVID. But I would start with your insurance company first, and then if you don't have insurance, getting on the web or our most reliable is telemedicine with myCovidMD, because we know them and we trust them.
And then can you speak a little bit in our last few minutes? Again, thank you everyone who's just signed on, and those of you who are with us. We're here with Nanaefua, doctor in the ER. She's at the front lines, really, taking a personal toll and doing all the health things, and she's doing really beautiful work. So we're excited to get this information. We really need it in this time. And can you talk a little bit? You just have your app just launched. I think it's active now.
Yeah, the website is
MD?
active.
Okay.
It's a web platform until the app comes out. Yeah, so myCovidMD is the actual app, and it's the goal of myCovidMD is to get access to telemedicine and telehealth services. And the third thing is a crisis buddy to anyone who is uninsured or outside of the medical safety net. And in order to do that, we want to outreach to nonprofits and to commissioners, city commissioners, and anyone who's working in the startup space as well, because contract workers tend to fall in this gap too. The way it works is right now you just can go to the website, lots of information on what to do, symptoms, and we have an assessment tool that you can do for yourself. But you sign your name in there. If you want to volunteer for myCovidMD, our sponsors are offering an emergency savings deposit for our volunteers, as well as some student debt relief. So you can sign up there and you list the skill sets you have. And then in about a week, you'll see that you can drop it from the App Store itself as a beta. And those betas are actually, we're using it as live, so you can reach someone at that time. The goal is for you to be able to contact Crisis Buddy, which is a health provider, within 15 minutes. So we'll book the appointment within 15 minutes. And then if that person knows about the resources in your neighborhood and can help you screen whether or not you need to be seen by a doctor. And then we connect you with our telemedicine doctors, and that's within either 15 minutes as well. You can schedule later appointments if it doesn't work out, but we do it very minimum 15 minutes because we really want people to get connected. The beautiful thing about it, though, is once your profile's in and you're registered, then that Crisis Buddy is going to send you text notifications about things as we get updates. So we'll get information, the situation reports, you'll know all the facts is what we send out. If you don't want them, you want to be in a quiet space, you don't want to hear about it, you can turn off text notification, that's fine. But you can also video call your Crisis Buddy. And so if you have a quick question, your Crisis Buddy can answer those questions. They only have 7 minutes of time when you call them, but they're available for you throughout the journey of this time period.
And is there a cost to this at the moment? And will there be add-ons, or will there always be like a basic free version, and will there start being like you can add on services? How does
the CovidMD.org was a call to action. We don't know where this is going to go afterwards, so we set this up as a free program. Period. We rely heavily on donors to support us, businesses who believe in what we're doing to donate to it. But we believe that healthcare is a human right, and at this time, more important than ever, people need access. And so maybe 6 months down the line, we're in the cooling period, we may convert that to something different that it continues to provide some kind of emergency response care. But for now, even if you have insurance, maybe you just like the idea of having a Crisis Buddy, you can sign up, and if you can afford to pay, then add $20 to the donation pot and it helps for somebody else,
That's so beautiful. Definitely. Thank you for doing this. It really means a lot. I want to take a couple more minutes, and I really just want to ask you sort of a question, especially for our communities of color. Yeah. There is this turn from me to we that you were mentioning to me. Can we just speak a little bit about that? And of course, we are always we. Right. We're always we. Let's just be honest. We're always we. Yeah. And what would you like to share with our community right now about that? And how do we still stay who we are and be our best selves, but deal with this? Yeah,
I think, I'll start with many are called and few are chosen. And especially in our African-American community, Black and Brown community, we've always seen suffrage, but we've always suffered, but we're not suffrage people. We always climb out of things. And when we're talking about this case where this particular doctor was just like all these young people pretending like this is not serious. And, we've lived in this world where it's a me thing. And we're in a space now we need to think about the way that the collective, the society. And, for Black and brown people, we've been saying that forever, right? What was police brutality? Where was the we in healthcare inequities? Where was the we in economic injustice? And it's hard. Then you're like, oh, now you want to call me to task, right? And it's one of those things that Michelle Obama so eloquently said, you have to rise. You have to, even despite that, the universe has an interesting way of correcting itself, right? So if you stay true to what is right, we are Americans, no matter who thinks it or not. And so we're showing up for our fellow citizens, and we are being there for them in this time of crisis, and we're doing our part by staying self-distancing so we don't spread it. And then when things calm, then we need to show up again and vote. We need to show up again and say and vote. And also make sure that, this opportunity where all eyes are on the fact that there's holes in our healthcare system, that we don't forget, and that we make sure that we don't just put patches on, we actually recreate a healthcare system that's equal for everybody. And this is just healthcare. It could be everything, but this is my language.
Yeah, this is your language, and this is what we're talking about, because healthcare at the basic, if we don't have our health, nothing else really matters. If we don't have our people, nothing else really matters. Okay. And you said it so, thank you for saying it so eloquently. And when you quote or reference Michelle Obama, the Queen, it doesn't matter. It's all right, because she's right. Well, that is really so beautiful to have you here. It's so comforting. Every time we have a vote for Dr. Nana. Apparently you're going to run for VP now. I agree, mutual combination.
But I like to be on the front lines. I'm down, on the grind.
I love it. And that's what we're about. For those of you who don't know, Blackbird is a collective for women of color, allies to diversity, people who are about having brave, courageous conversations and creating this community in this collective where we lift each other up. Like Rihanna said, pull up, y'all. Like we really, there's so much amazing work that you all are doing out there. We want to know about it. And in this time, the biggest thing I'll say is we're going to get through this. Mm-hmm. It is not easy. Mm-hmm. It's a devastating, any percentage of loss of life is devastating, especially unnecessarily. But that's why vote is so important, because leadership needs to take control and be like Cuomo is stepping up. And, we have...
Can we get snaps for Cuomo?
Yes, okay. And my girl Kamala Harris, she's over there like fighting for these bills. Stacey, we have our champions, Elizabeth Warren. We have, and Bernie obviously has always been about healthcare for everyone. Like, let's just be real. And your vote is so important. There's no way that you don't step out this time for that. It's for it, and to see how important it is for us. We're all, and then I'll say the last thing I'll say is we're all connected. This is a surreal time, but it is so real that on a global level, we've had to slow and connect and check in with each other and be diplomatic. So let's take the beautiful part of that and hope when we come out on the other side, which we will, that we come out with more sense of humanity, more togetherness, more compassion, and we interact in a safer way, and we all will know how to wash our hands, because I never knew about the thumb, y'all. Who knew you're supposed to wash your thumb? Doctors knew. Okay, I'm done on my soapbox. Nana, would you like to take us out? Is there anything else you'd like to say? Again, everybody there, thank you for joining. Please, we're going to put this on the story so you can check it the rest of the day. But I will leave it for you. Thank you for being here. It's always a pleasure and so reassuring.
Thank you. I'm so happy Blackbird came to my life, because even in the space when we were planning to be in a Zen space like that. When I walked in, I knew from the day one it was a real place with real people, with some compassion, and having a workspace like that, it means a lot. There's a lot of workspace bumping up, but it's not a work and wellness spaces. And so I salute you for what you're doing. I hope you grow and win and win and win and win and win.
Thank you. We're trying. It's a tough time, but we're doing the best we can.
Yeah, and that's why we have to pull together. I will say though, I want to applaud the young people, and I want us to show up for young people, whether it's by voting or giving them the space to hear their voices. They are coming up with innovation that is to change things. I think we need to lower the opportunity for young people to get in the voting, because it will change the way our system is, because they always show up. They always show up in crisis, and then we act like they don't know enough or they're too young, but they're seeing it, and they have seen the world that we live in, and they have a vision for a better world, and we need to give them space and room to actualize that vision. So that's what I will say. I thank all the young people who are supporting the healthcare providers. Read the bill to $2 trillion. Make sure you know what's in there. I would say that it sounds good. Just read it, because it could be better. It could be more inclusive. But yeah, and all that, I just say that, show love. My COVID kiss, keep calm, wash your hands. If you're sick, self-distance, don't isolate. Show love and compassion wherever you can, and share facts, not fiction. Thank you.
Beautiful. Thank you. Thank you for all your work. All right.
Bye.
Bye.
Thank you.